I'm Dr. Kevin Cavanaugh from HealthWatch USA and would like to discuss the viral spreading of COVID-19 and the prevention of contracting this illness. It should be noted that much of this information is based upon observational studies, and some of these studies are extrapolations from the seasonal flu virus. Thus, as more information is gained, expert guidance is expected to change. The survivability of the coronavirus in the environment is not nearly that of bacteria. In a recent study, it was observed that the SARS-CoV-2 virus can survive on stainless steel and plastic for up to 72 hours, on copper for less than 4 hours, and cardboard for up to 24 hours. Of note is that it can survive in aerosols for up to 3 hours. Disinfectants are commonly used to deactivate the coronavirus once it gets upon surfaces. Contrary to popular belief, soap and water may be excellent in deactivating the virus. The coronavirus has a lipoprotein capsule, and this should be destroyed by soap and water. Soap and water also has the advantage of washing the virus off your hands. Unfortunately, water is not always available when one has to disinfect your hands, and because of this, another alternative is the use of alcohol-based hand rubs. These should be composed of 60% or greater alcohol, either ethanol or isopropyl alcohol. Hand rubs, similar to hand washing, should be performed for 20 to 30 seconds. There is, however, one study which indicates that if a virus such as the flu virus is coated in mucus, the alcohol may have difficulty deactivating it. And if there is any grease or grime on the hands, soap and water needs to be used to remove this. Thus, soap and water may actually be a better alternative than alcohol-based hand rubs. And if you are around a sink and soap and water is available, you may want to consider using that and saving your alcohol hand rubs for a time when soap and water is not available. One important warning is that the FDA has found a number of alcohol-based hand sanitizers to contain the alcohol compound methanol. Methanol is a poison, and these hand sanitizers should not be used. Outdoors also tends to inhibit the spread of the virus. Some reports is that there's a 20 times less of a risk outdoors than there is indoors. This is data taken from a study which was commissioned by the White House, and this shows a marked reduction in the virus being outdoors and in the sun. As can be seen by this data, the warmer it is, the less the virus survives. Also, the sun tends to kill the virus. This is thought to be due to the UV rays, both on the surface and if the virus is in an aerosol or floating in the air, the survivability drops to a few minutes as opposed to hours. Humidity is also a factor in survival, and as the humidity increases, it can be seen that survivability tends to decrease. Humidity, however, is kind of a complex variable, as shown in this study and by this graph, is that in some conditions and temperatures, when the humidity rises, survivability may decrease, but viral spread and transmission will tend to increase. In other words, the aerosolized viral droplets become more stable and more readily able to float in the air. Distance is also very important. There is a standard which many of us hear is to be 6 feet or greater away from a person, and this is called social distancing. But 6 feet in itself may not be enough, and this standard is mainly set for the spread of droplets. In other words, are large particles of spit and mucus. These will fall quite rapidly, usually within 6 feet. However, if these droplets are propelled by a force, such as a cough or a sneeze, they can spread much further. A cough can spread these droplets up to 12 feet at 22 to 50 miles per hour. A sneeze, these droplets can spread 23 to 27 feet at 112 to 200 miles per hour. But there is a considerable body of evidence that's beginning to form that these droplets can also spread in the form of an aerosol. where very small particles of this virus, usually under 5 microns, can spread and float in the air. Aerosols can be produced by a variety of means, both with talking, loud talking, singing, sneezing, coughing, and also artificially, for example, with medical procedures. It has been observed that aerosols can float up to 20 feet away from the infected person, and in order to stop an aerosol, one would have to wear either an N95 mask or be very far away. Social distancing would then have to be much greater than 6 feet. There have been 4 studies which indicate that aerosol transmission of the SARS-CoV-2 virus can take place. The first study was in March of 2020 from a church in Washington, where there was a 2.5-hour choir practice. It was attended by 61 individuals, and 32 developed confirmed cases of COVID-19, and 20 additional individuals developed probable cases. 3 were hospitalized and 2 had died. An epidemiological study of this event indicated that transmission was probably from aerosolization of the virus. In July of 2020, an outbreak at a restaurant in China was extensively studied and observed that the pattern of transmission was consistent with that of the flow of air with air conditioning, and the virus transmitted further than the 6 feet social distancing guidance. Virus transmission was also studied in the hospital wards in Wuhan, China, where they found that this virus was widely distributed on floors, computers, trash cans, handrails, and was detected in the air approximately 4 meters from patients. Again, much further than the current guidance regarding social distancing, and indicates aerosolization of the virus. And finally, there was a laboratory study of healthy individuals which loudly stated the words, "Stay healthy." They observed numerous droplets being formed between 20 to 500 microns. Some of these droplets are very small and started to enter into the range of what an aerosolization particle size should be. The World Health Organization, however, has not fully embraced the concept of aerosolization with the COVID-19 virus. However, an open letter from 239 scientists from 32 countries outlined to the WHO the evidence regarding particle size and infections with this virus and calling on the agency to reverse its recommendations. It should also be noted that the COVID-19 virus has an R0 of 5.7, which, when much more infective than the seasonal flu, is not as infectious as the measles. Thus, the virus may not be truly aerosolized. In addition, cohabitants in a home with an asymptomatic patient have only a 20% chance of catching the virus. One would expect that if the virus was truly aerosolized, that the infection rate with cohabitation would be much greater. So the overall take-home message is that aerosolization under some conditions can occur, and that physical distancing and masks should not be relied upon for 100% protection. In a study published in The Lancet, they looked at the type of protection which can be obtained from physical distancing, use of masks, and eye protection. Physical distancing over 1 meter compared to less than 1 meter provided almost a 6-fold reduction in transmission of the virus. Face masks produced a similar reduction in transmission of the virus, that being approximately 6-fold, with a surgical mask providing some reduction and an N95 respirator providing the most. Eye protection with goggles or a shield provided a 3-fold chance of reduction of the virus. From this data, one should realize that if you wear a mask alone and not protect your eyes, you are not going to be 100% protected from the virus. And if the virus aerosolizes, an N95 respirator will be needed as opposed to a surgical or cloth mask. The recommended distance for social distancing varies widely between countries. In England, Canada, and Spain, they advise 2 meters, as several countries such as China, France, Singapore, Hong Kong, and Denmark advise only 1 meter. The exact distance you need to be from someone is dependent upon both the amount of time you are exposed to them and also whether or not the virus will aerosolize. Obviously, if the virus aerosolizes, 6 feet away is not nearly enough. If one were to spend 6 seconds at a distance of 1 meter, have the same risk of transmission as spending approximately 1 minute from someone at a distance of 2 meters. There are 3 types of masks. One is an N95 respirator. It can stop aerosolized particles of less than 5 microns in size. It requires a tight fit and no gaps around the face. This respirator will stop 95% of these particles. There is also an N99 type of a mask, but the N95 mask is the one which is usually used for most medical encounters. There is also a surgical or procedural mask which will stop droplet particles. They do not fit tightly around the face, thus aerosolized particles can come in around the sides. And finally, there's a cloth or do-it-yourself mask. These masks can also stop particles. Their effectiveness is largely dependent upon how they are constructed and made. The public wearing masks is largely intended to stop transmission from the mask wearer to other individuals if the mask wearer is an asymptomatic carrier of the virus. As you know, asymptomatic carriage can be responsible for up to 50% of the transmission of this virus. Thus, wearing a mask alone will not adequately protect the wearer from getting an infection, especially if they're not wearing goggles. However, it will reduce the viral load that person is exposed to if they come in contact with someone with COVID-19. And there are some studies which suggest that if you develop COVID-19, the fewer viral particles you are initially exposed to, the more likely it is that you will have a less severe disease. A number of studies have shown that even homemade masks can block a significant amount of viral particles, which may prevent or at least lessen the severity of COVID-19 disease developing in the mask wearer. And this is especially true for particles which are of large size, such as blocking droplet particles. As stated before, an aerosolized virus which can come in around the sides of a mask probably are not going to be effectively blocked by either a cloth mask or medical-grade surgical mask. An N95 respirator is required. But as Konda et al. Observed, a well-fitted and well-constructed cloth mask may also block 80 to 90% of aerosol particles below 1 micron, which is equal to 1,000 nanometers. So how do masks work in the real world? Well, cloth masks appear to work quite well in preventing disease, and this is illustrated by an outbreak which occurred in a Missouri hair salon where 2 hairstylists serviced 140 clients with 200 to 300 other people in their salon, and no one developed an infection. All wore masks and all social distanced when able. This event was studied by the CDC, and it is a testament to the effectiveness of masks on stopping the pandemic. This slide contains links to a number of instructional videos along with pamphlets containing patterns and instructions on how to make cloth masks. Please download the presentation slides from the website in order to activate the links. As a general rule of thumb, if you're wearing a mask and you can blow out a candle, it's probably not a good mask. In a medical setting, however, cloth masks did not perform as well as a medical grade mask composed of 3 plies of non-porous material. Thus, if you're in a medical center and you are exposed to patients with influenza-like illness or SARS-CoV-2, you should have a mask which is capable of filtering out the most viral particles possible, because you're in an area with high particle exposure for a long period of time. Some of the best news which I have heard is that people abided by social distancing, hand hygiene, and the wearing of masks, that this in itself might stop the pandemic. It's been reported that if between 85 to 95% of the people abided by these public health recommendations, that the epidemic would be severely blunted. One study from the University of Cambridge found that the epidemic could be stopped if 100% of the public wore masks and this was combined with a lockdown. If only 50% of the public wore masks, then the curve could be flattened. Another study from Berkeley's International Computer Science Institute found that infections would plummet if between 80 to 90% of the population wore masks, but if only 30 to 40% wore masks, almost no benefit would be obtained. These recommendations are not so much to protect the individual, you still need to be very careful, but having residents in the community wear masks can blunt the epidemic, decrease infections, and result in the saving of lives. As stated before, eye protection can result in a threefold reduction in transmission and provide added protection to what face masks alone can provide. As rates of the virus are going up in communities, the wearing of face shields and masks are becoming more and more advisable. Presently, both Dr. Fauci and Dr. Bix have talked about the positive effects that eye protection can have. Needless to say, the highest risk to be at is indoors. If one is outdoors, there is a 20-fold lower risk. If you are in a crowded area, there is a higher risk. If you are in contact with individuals for a long period of time, the risk goes up. And if there is loud talking, singing, or cheering, the risks also increase. Presently, I feel that bars are one of the most riskier venues for catching COVID-19. Inside bars, people are usually close together. They are not with their normal social group or bubble. There's loud talking over music. They are usually indoors with poor ventilation. Exposure time is greater than 15 minutes, and usually the patrons are not wearing masks. Of course, mitigation strategies are social distancing, wearing masks, adequate ventilation with air sterilization. There's no singing or loud talking, having a bar outdoors or in the parking lot, and to stay within your family bubble. Shown here is a picture of an outdoor bar, and although being outdoor helps, every other guidance is being ignored. They're not social distancing, not staying within their bubble, not wearing masks. There's loud talking, so one would be fearful that this would turn into a super spreader event. Churches can also be a high-risk venue where parishioners are sitting close together, singing, not wearing masks, being indoors with poor ventilation, and exposure time greater than 15 minutes, and they are often exposed to individuals not within their family bubble. There are, however, a number of mitigation strategies, that of social distancing, increasing ventilation, wearing masks, not singing, or if you do sing, at least sing with a mask, having the service outdoors or online, and of course, staying within your family bubble. All of these are very good strategies, and many churches have turned to them to offer religious services in a more safe environment. There have been super spreader events, such as in Kentucky, where one church in Nicholasville had an outbreak that was associated with their congregation. 18 members of the church had a positive test for COVID-19. Afterwards, it was decided that the church would be best to go to online services. The health department felt that these cases were associated with attendance at the church, although the church is still somewhat undecided as to the exact cause of the outbreak. Indoor dining is another high-risk venue, especially if individuals are crowded together, people are talking loudly, which can produce aerosolization of the virus, and there is not good ventilation within the restaurant. Thus, mitigation strategies are social distancing, wearing masks when not eating, outdoor tables, adequate ventilation with air sterilization systems such as UV lighting, and offering delivery or pickup services. Shown here in this diagram is the outbreak in China, which was discovered, as you can see, by the individual who is labeled A1 and is yellow. This was the index individual, which, with aerosolization and spread of the virus along air currents from the air conditioning units, a number of individuals even further than 6 feet away, became infected with the COVID-19 virus. Thus, whatever business you are in, mitigation strategies include offering online ordering and delivery, curbside pickup, requiring masks and social distancing of patrons and staff, and for employees, consider constructing plexiglass barriers between the employee and the patrons, and also requiring face shields and goggles to be worn. Now, finally, I'd like to talk about the issue of whether pets can transmit the virus. There have been a number of case reports and studies which have indicated that pets can carry the virus. One report, as shown here, has even documented a death from COVID-19 in a German Shepherd. However, I feel the best guidance, one which is also given by the CDC, is that animals are probably a low risk of transmission to humans, but they should be treated just like any other member of the family when it comes to COVID-19. So I think that more study needs to be done in this area, but until then, they're a member of the family and they should be acting the same as the family and doing the same precautions. Thank you very much.